Good afternoon, everybody. Today is March 5th, 2021. This is the Falmouth Health Department. My name's Scott McGann, doing our weekly COVID-19 update. The website where you can get the most recent information is falmouthma.gov. You can email the health department at health@falmouthma.gov. Non-vaccine related COVID questions, guidance questions, complaints about places, use 508-495-7485. That's the health department's number. County COVID hotline is 774-330-3001. That's also not for scheduling yourself, but there's two resources that you can use. As far as where we are, we're still in the same phases that we were in last week's presentation. 65 and older, two certain medical conditions that are listed, 75 and older, and anybody left in phase one, which would be your first responders and things of that nature. So we're still at that point. Actually, the teachers are allowed, as starting early education and K through 12, are allowed to start next week, the 11th, I believe, as well. But that will be starting next week, scheduling next week. As far as scheduling, what's the same is that the website at mass.gov for vaccine availability and the sort of what I call the Willy Wonka and the chocolate factory trying to get a golden ticket is still there. We are chipping away, and when we talk about cases, talk about vaccinations, we are getting people vaccinated. It's not quite at the rate we all want, but the state's only getting about 100,000, I think 140,000 vaccines on a given week, so that it makes it scarce when millions of people want it. But it's still the same. The state does have a registration call center at dial-in 211. We at the town also have a decentralized call center. We just have not activated it yet, mainly because of the lack of available appointments, especially locally. So having people sitting on the phone for several hours trying to get a single appointment, because that's just the way it is right now, isn't really productive. But there are some avenues for you, and I'll talk about that in a second. So those who are over 60 should enroll with the Senior Center for updates. So that's 508-540-0196. And again, you can also use the call center helpline at the county that I gave you before, the 330-3001. And I'll talk about the Senior Center in a second. As far as vaccine supply, so it's still in relative short supply. You did hear that Johnson & Johnson did get approved. The Mass DPH is looking and putting most of the vaccines towards mass Vac Sites and in the 20 communities that have had the greatest COVID burden. The county's still receiving, it's about 1,170 doses of the Pfizer on a weekly basis. They did get 1,200 doses of Johnson & Johnson's. Those go up for the online registration and the golden ticket method for next week. I believe it's Tuesday, Thursday. There'll be two 600-dose clinics. Those are single shots, so you don't need to come back for your second. There'll be two clinics. The 1,170 that's coming in for Pfizer for the next few weeks will be second doses for the ones that were done, for the people that were done earlier on. So it's not like the county's getting 2,300 per se, and then in doing another new 1,170 on top of it. So the Pfizer doses that are coming in are for that. They're going to be the two clinics are going to be at the 4 Cs for next week. Your registration, they're probably gone in 20 minutes to 30 minutes. They do go quickly. But there are two clinics with J&J. That'll probably be a one-shot with J&J for a little while, just because they're all going to be given out. The stockpile the state's not going to get that on a weekly basis for the next few weeks. And then as doses come in more and more, we'll be rotating the vaccination sites. The fairground is our local site. The Orleans DPW is the Outer Cape. There's one in Eastham, and the 4 Cs. The 4 Cs is being used, and I'll talk about that in a second, jointly between Barnstable County. I'm talking about Barnstable County right now, and then we'll talk about Cape Cod Healthcare in a second. But as supply increases, more clinics. We easily could run the fairgrounds 2, 3, or more days a week. It's just the amount of doses. It's not the limitation of the nurses or the limitations of the site or the volunteers. It's the limitation of the doses that keeps us from having more frequent clinics at the fairgrounds. Again, the Mass Vac Sites are Gillette Stadium in Foxborough, the Dartmouth, near the Dartmouth Mall on Route 6, the old Circuit City building. Those are your Mass Vac Sites. That's still where most of your appointments come from. The regional sites will be, we replace the Melody tent with the 4 Cs, the fairgrounds, or again, Orleans DPW, and then there'll be Lower Cape. Also, pharmacies. Pharmacies are doing it. They're doing it on a daily basis. People need to be checking the CVS's and the Walgreens frequently to see if there's any availability. If you're a veteran age 55 and older, you can get it through the VA. The closest one is in Brockton. You can go on the VA's website for that, or you can go on mass.gov. There's a link as well. But veterans can get it through the VA if they can make it to Brockton. So that's sort of similar to last week, with having a nice 1,200 next week. J&J, one shot, takes care of 1,200 people. That's good. I talked a little bit last week. This was all coming together. You probably saw it in the paper if you've been paying attention on the paper, Enterprise, and also the Cape Cod Times. The Regional Vaccine Consortium, Cape Cod Healthcare is to begin a limited vaccinations at 4 Cs, again, using it either in tandem or on different days with Barnstable counties. For the region's most vulnerable residents and senior citizens, this will not be online registration. So you would want to call the senior center to see if you qualify. If you're in that boat where you are vulnerable, you do not have access to a computer, you cannot register yourself, you can talk to the senior center and they will talk to you about whether you would qualify for that. Also, the homebound, when I mean homebound, it takes a nurse, one nurse or one vaccinator can do 2 people an hour. So it takes about a half hour because you have to wait and make sure they don't have a reaction. So there's definitely not an economy of scale when we do the homebound. So those that cannot make it to a clinic that are truly homebound in Falmouth are being done using the Community Health Center of Cape Cod. They've begun doing that. If you think you qualify, if you're truly homebound, meaning you cannot make it to even a doctor's appointment or, everything has to be brought to you, you want to call the senior center and they'll talk to you about being on the list of homebound. Obviously, we want to have that as limited as possible just because of the amount of effort it takes just to do homebound. You don't get a lot done. You have to put a lot of effort not to get a lot of people done, so we want to make sure you're truly homebound. Again, the senior center is 508-540-0196, and I'd like to thank Jill Bishop and her group there, her staff, because they've really stepped up in talking to the seniors and those vulnerable, getting them over to either Cape Cod Healthcare or the Community Health Center. And again, that's limited to those who just cannot get on the what I call the open market for a vaccine. And so that's a couple of things that have changed over the last week. And if you feel you've meet into either one of these, then let the senior center know. Okay. As far as vaccines this week, the Barnstable County is up 6,821 vaccines from the previous week. Still on the slow side. You can see we're still lagging behind the delivery. Again, it's not our ability to give out vaccines. We have plenty of ability and capability. It's about what the state is sending us. They're still sending us, I think, we're still being shorted in my opinion, but it is what it is. And so that's where we are. This is updated. This isn't something I've made. This is something that's on a weekly. So if you go to the DPH's website, mass.gov, and look up with the case trends and everything that you can look at every day that we've talked about since the start, you can also get the weekly. This is the weekly vaccine report. If you look where we are as a county, this is doses shipped. So if you look at this, you say, well, then we've been getting our fair share. And I still think because we have a higher population of those over 75, we should be more like Berkshire County, the outer Massachusetts at 31. We're at 20.9. We're up 3.3% from last week, total doses shipped. But I think we need to be higher percentages, more similar to what you see on the Vineyard in Nantucket. And it's not because our inability to dispense it, it's our just not getting the doses. So that again is also updated on a weekly basis at the same mass.gov website. As is this one as well. It shows that the percentage of residents with at least first dose administered is 24.1% in the county. That's up 4.2. Those that have received second doses that are done is 8.9, which is a gain of 2.7%. So we are chipping away. We are getting people vaccinated. It's just really hard to get an appointment, find it. You just have to keep fighting for it. A lot of people are getting it through the pharmacies or making it out to Gillette. and the few Barnstable County run clinics that the towns are involved with, the town health departments are involved with, are, they're as soon as we get them, we administer them. So that's where we are with that. So it's a slow crawl right now. I think things will definitely get better as the supply gets better, but this is where we stand as of yesterday. So that's it about vaccines. We're getting there. It's just slow. So in terms of cases, we're at 1,201 cases. Our first case was on March 19th, so we're getting close to a year, just about a year. That's 57 of the probable cases since the beginning of February. So this past week, there was 24 cases in the 7-day period. I take this on Thursday night. About 97% of the cases are out of isolation. As the case number drops, then our out of isolation number goes up. We remain about 11.8% of the county's caseload, which 14% would be expected. And of course, contact tracing, we're still doing the contact tracing, as we always have been since the beginning. Our weekly case trend, you can see that we've flattened out pretty good in that mid-20s to low 30s for the last 4 weeks. Didn't see much of an increase from school vacation week where people did travel. Some of us did travel. And that doesn't seem to have played out, which is great. It seems we're in sort of that trend of that 25 to 35. Of course, we'd like to get that down, and we'll keep working on our contact tracing to help make that happen. But we're not at that 100 that we were per week in about a month ago. So it's good. Just like to see it get better. And for the time of year, it's not bad either. I can see where we were back once the weather got warm, we stayed under 10 most days, 10 or less, most weeks, all the way through the early fall. Hopefully that happens again with the vaccinations. We can be at an even lower rate this upcoming summer. But for the winter, not a lot of people vaccinated. We're doing, I think, okay. This is our total number of cases. The flatter that line, the better. You can see it's slowly flattening out a little bit from the huge increase that we had from December into January into early February. So, again, we just want to keep getting the cases down and keeping them down. As far as our metrics, green, yellow, red, the 43 cases, we haven't been able to meet 43 over 2 weeks, less than 43 over 2 weeks. So that's, we're close, but we're not quite. We're in the 50s, not the 40s, which could bring us to green. But so our choices would be the yellow or red, which we would remain yellow, with a slight increase in percent positivity from 2.16 to 2.47. It's down at the bottom here. Midway down, the end of the show for Falmouth. Part of that is because the testing has been under 3,000. Our cases have been in that 25 or so range, 28, somewhere in that range, 25. Testing's a little bit less per week when we were back up at the 4,000s around Christmas time. And so that makes the percentage to be a little bit higher because it's based on number of tests. And a lot of people are getting the probables. So the number of tests, this is all PCR based. The percentage is probably going to be roughly the same with a probable. You have less cases because some of them people took the rapid antigen test, which is what's considered probable. This is all PCR. But also that test doesn't show up as a test, so the percentage should be relatively the same. The state is right under 2%, so we're slightly higher than the state in our percent positivity. So again, we just want to keep driving it down. Barnstable County's at 3% for the county. Caseload, you can see that spike is same happened everywhere on the Cape and pretty much anywhere in Mass. The cases that were like around 6,000 in the state and around, we are having in the hundreds. Barnstable County is down into, the more manageable 50 plus or minus sort of range. From the state's dashboard, you can get this off the dashboard. This is by county. You can see that the darker the color of the map of the Cape, the more cases as a percentage of population. So we're somewhere in the middle as far as our cases, as far as our percent positivity. Bourne, Sandwich, Barnstable, and Mashpee's has been higher over the last 14 days. We've been more in that Dennis, where Dennis has been, and then the Outer Cape has always sort of done better. Less people, less congestion, less things going on helps too as well. So that's where we're at. We've always held our own, I think, for the most part, week to week. We've done fairly well compared to our counterparts on the Cape. Total cases have been hovering around the 15, less than 2,000 per day. Our positivity has been under 2%, which is a very key number. It shows that the disease is on a decline. Turnaround test is now in better shape at 1.41 days. It was higher as the 3 days prior. So it's about a day and a half on average turnaround for a PCR. We're averaging around 100,000 tests in the state per day, so it's still pretty robust. Hospitalizations has been under 1,000 for a little bit now. It's at 741 with 100 patients intubated. So what's helped is we've vaccinated a lot of long-term care, which helps us with the death rates and helps us with the ICU and the intubations. With 42 deaths, the deaths will linger higher than the cases will for a while because people that are intubated or in the ICU tend to be there for quite some time, so that number generally gets delayed. All the trends are fairly flat. You can see right at the end we're sort of tailing. Confirmed cases is still on the decline. Percent positivities low, but sort of flattening out a little bit. So everything's still on a good trend. As vaccinations increase, these numbers should stay down. So if we don't see another spike, then we should still see that keep trending on the downward. Hospitalizations have been fairly good at Falmouth Hospital. The 25th was 2 hospital beds. We're still at 2. 1 ICU, there's 0 in the ICU. Cape Cod Hospital's been in the 10 to 4, 12 to 2. So pretty stable there. And it's numbers that the hospitals can't handle. Testing hasn't changed. You still get it through Falmouth Hospital, through your physician, Convenient MD, CVS, the community center in Mashpee still does them. We have free testing through Barnstable County Fairgrounds. You would call the fairgrounds directly, 563-3200, Monday through Friday, 8 to 2. They usually do that testing on Tuesdays. So you would call and Wendy and the staff at the fairgrounds have done a great job at taking that over and helping booking it so that it's not going through the county or through Falmouth Health. And so you would call them directly. That one is free. And so that's where we're at with that. So no different change. So it should be fairly easy to get a test. Rapid test, the only place I know of is the Convenient MD. Rapid tests are good. They're just not quite as accurate as a PCR. As far as guidance hasn't changed on March 1st. They've no longer a percent seating capacity. It's really about the separations in restaurants. Still have to have food courts closed, self-service closed. But now it's about spacing. That's where we were, I think, in the fall, before we had the spike. Some changes in venue and capacities and so forth. And starting on the 22nd, we would go into phase 4, parts of phase 4, which has got to do with things like Gillette or Fenway and these different type of venues. I call it Great Woods. I don't know what it's called now. Now it would be at a 12% capacity. Capacity under 5,000 is still subject to the normal indoor and outdoor performance. So that is, a light at the end of the tunnel that we're starting to even talk about phase 4. So things have opened up a little bit. And again, it's going to be based on data. If we see the governor sees a spike, we'll go back down. Again, stay at home when ill, self-isolate, get tested, keep going with the diligence with social distancing and the face coverings. Get a good face covering. Again, hand washing, hand sanitizing, keeping travel down, quarantining upon arrival. Get tested when you come back per the guidance that you can get on mass.gov. There's still the parties, the gatherings, meeting people, indoors especially, without the social distance, is still where you tend to see the cases. And if you're a business or a place of worship, if you have some gatherings or some events coming up, you want to follow the guidance. So nothing's changed on this front. So as a recap, state metrics are stable. Falmouth remains yellow in the 23 to 35 cases per week for the last 4 weeks. You can still get it, so community spread still does occur. Regionally, vaccines being administered as it arrives, and the supply will definitely get better. We have Cape Cod Healthcare taking care of the vulnerable, Barnstable County Health and the Environment, which is Barnstable County, which is where myself and the other health agents are, definitely tied in with Barnstable County. We're working it through, and we're doing the clinics as the doses arrive. The community health center for the homebound. And again, pharmacies are still a place that you can get it. You have to check that frequently. They give out, so many a day. So your pharmacies are where I think quite a few people are getting done. And of course, you can go to the mass Vac Sites and do that. And again, the state has loosened guidance since the beginning of the week. So, just keep, not much different from this week other than what Cape Cod Health, from last week rather, other than the Cape Cod Healthcare component and the community center helping us do, working with us to do the homebound. They've done some homebound. So again, the main thing to get out of this, if you're 75 and older, you can't register, you feel left out, lost on the whole process, call the senior center. Jill's, again, staff's done an awesome job. And they'll put you on a list, provide it to Cape Cod Healthcare. Cape Cod Healthcare has been at this time reaching out and working on getting those individuals vaccinated. Okay, so that's the main thing I want you to do. Also, that she does a lot of the information that we get, we send out through a blast with Jill's, and she has different methods of getting a hold of you. So I would like you to make sure that that you're on their list at the very least if you're over 60. And so that's what I have for this week, and I'll see everybody next week. Thanks.